Hi, I'm so happy to be here to talk to you about a great strategy to push with an epidural. I know there are many reasons why epidurals can be the right choice, and if that is you, I want you to feel that you can get through this part of pushing your baby out in a way that feels pretty great and helps keep you and your baby safe. So our goals with this strategy is that the reason we push this way instead of that old, outdated way is because it is less stress on baby. It's less time where you're actually actively pushing. There's less risks for severe tears, less need for forceps, and less need for vacuums, less need for C-sections, more of you getting to be the one birthing your baby and bringing them into the world. So a couple things that I want to point out is that many providers, if you have an epidural especially, will say, oh my goodness, you're 10 centimeters, you made it, let's start pushing right now. But if your baby is still pretty high and you're having that nice steady contraction pattern and everyone is still doing great, then your baby can actually descend quite a bit lower without you pushing. So if you can, ask your provider if you can choose to wait. Advocate for yourself to choose to wait until you feel pressured and the urge to push. If you're feeling absolutely nothing at all, maybe ask them to turn down your epidural just a smidgen so that you can start to gain some more sensation so that you can feel exactly what you're doing. Most of you will still feel the pressure of your baby and still feel a bit of an urge to push at some point if you labor down for a while. First-time moms, you can labor down for about 2 hours is what the norm is. And for second-time moms or more, about 1 hour should be good for you. During that 1 hour or 2 hours, go through that positioning thing that we talked about before with active labor and change positions every 15 to 20 minutes. Move, 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 so your baby can come down, 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 right? The less time your baby is coming down without you pushing, the safer things will be and the less work it will be for you in the end. So let's talk about really good pushing positions where you can take advantage of gravity and work with your pelvis and the shape of your pelvis so that you're not pushing in a way that's extra work for you and for your baby. Really good principles to follow, the same principles we followed for non-epidural births, which is upright, on your side, and then we're going to add an extra thing, which is with oomph, because sometimes it's a little hard to feel the muscles you're pushing with. If you've practiced this before labor, especially like when you're going to the bathroom is a great time to practice pushing, then you probably won't need this, but you can always use a sheet, a blanket, a hand to help you get extra force where you need it to be. We'll talk about that in just a minute. One position I would suggest that you avoid is the semi-reclined position. This is super, super common, and when I'm in the hospital, this is almost always the first position that I see. It's just assumed this is the go-to pushing position. However, when you're directly on your tailbone like that, your tailbone can't move down to make more space for baby. So if your care team does want you on your back like this, take a bunch of towels, roll them up, and stick them along your hips on each side so that you're actually elevated a little bit above the bed, and your tailbone can sink down onto the bed. But other than that, let's go through some really cool positions, things that you probably didn't realize that you could do on that hospital bed to get into positions that will actually help your baby have more space, have more ease as they're coming down and out. So the first is hands and knees on the bed. There's 2 ways to do hands and knees. If you have an epidural, you may need help. If you're feeling too shaky and you try it, then don't feel like you have to do this one, right? But look, your baby has like 30% more space in this position, and it is the most commonly assumed position for moms who are giving birth with no medication, who are just following their instincts, will often naturally just get into this position. So it's a great one to start with. You can do it hands and knees with the bed down. Your nurse can help you get the set up. You can have the guardrails up on the side to help keep you safe. Make sure that you have people by your side and helping you, and you feel steady and safe in this position. The other way to do it is to raise up the back of the bed so you can rest forwards onto it. If you are feeling good about being on your hands and knees, again, your baby is going to have so much more space to come out in this position than in that semi-reclined position that we looked at a couple slides back. All right, other really good positions where your pelvis has some space is if you are lying on your side. When you're on your side, you won't be able to lift your leg up on your own. That's where your birth partner or your doula comes into play. They can hold your leg for you so you can push. Alternatively, if you put the peanut ball between your ankles and a little pillow between your knees, this is essentially a squatting position. It's pretty much exactly the same as being in an upright position. Your pelvis can move a lot because you're not on your back, and you can push like that pretty effectively. Sides, you can also switch from your left to your right to try it on both sides. Try a few different positions and then pick the one that works best for you. And then one last upright position that works really, really, really well in my position is squatting, where you sit all the way upright, just like you were in active labor, and you hold onto that bar while you push. And then between contractions, you can just lay back on the bed, or you can lean forwards and rest your head. Stick a pillow right there on the bar and rest forwards there. Again, if your knees are in versus your knees out, you're opening different spaces in your pelvis for your baby to come through. So it can be really helpful to do 3 one way, 3 another way, just because the more you change that shape of the pelvis, the more you give your baby space to come down, or different, if you think about, if you're wiggling through a small space, having the space kind of give you more room can help a lot. All right. So if you're having a hard time feeling where to push, one thing you can do is have somebody tie a sheet around the squat bar, and then you can pull on it, which will help you activate your abdominal muscles coming in and giving you that hug to your baby, right? If you have a partner here watching this with you, try playing tug of war and see how that activation of your arm automatically gets you to engage your core and pull it in towards your spine, right? Because that's the biggest part that you want to do, belly towards spine. So add some oomph if you're having a hard time finding the right ways to push. Now, real quick, pushing with an epidural, you will probably need a little bit more coaching. I recommend that you talk about this with your doctor before, because most often what I see in the hospital is that people are still encouraged to hold their breath for a count of 10, and often a very slow count of 10, which can be too much. And that's often called purple pushing, where you're taking a deep breath and all your power is up here and you're pushing so hard and holding your breath so long, your face is turning purple and you can see all your blood vessels. You guys, that is not the safest and healthiest thing for your baby. If you are practiced and you know how to find the right muscles, you may not even see a lot of effort at all up here. So take a deep breath. I always say, take your hand, place it beneath your belly button, and try to breathe into that space beneath your belly button, right? And then you're going to bear down. Bear down by hugging your baby in and holding everything really tight while your uterus is pushing down. That way you can hold your belly in, let your pelvic floor muscles relax, and your baby can come down or out. Since you aren't going to be as in tune with your contractions, you're going to want to hold that for about 6 to 8 seconds. Whereas if you don't have an epidural, you pretty much will feel when to take a breath and when to take your break. Take your breath every 6 to 8 contractions and take a quick deep breath between pushing and try to get in 3 to 4 pushes of 6 to 8 seconds with every contraction. I know that sounds like a lot to keep in your head. Print this page out if that helps you, especially to help communicate with your nurse that this is the way you'd like to push as long as everyone's doing well. And this is what you're practiced and this is what you're ready for so that they can best serve you, right? Because if you don't come with a plan, they'll have a plan. It just might be a different plan than this one. So definitely print out all these slides so that you can show them to your care team and get their support behind these strategies, because it is definitely more work for them to help you in these positions, but it is safer for you and your baby. So if you know what you want, if you ask directly, and you are more than likely to get the support you need to push in this way and have this calm, beautiful, strong pushing experience, even with an epidural. All right, practice, 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 and I know you will be ready and will do an incredible job. I cannot wait to hear your stories and enjoy meeting your perfect little baby.